in some selected stroke patients. And I'm happy that the summit they had last year was in Abuja to sensitize the other states. They don't have all this other one in other states. And I think we should make it a national policy. It will be in the interest of the nation at large. And they will be able to roll back some of these infectious processes. It's still very ugly. I will still see patients coming down with tetanus, okay, at this century. I mean, it's almost unheard of in several other places. And those are things which, of course, if medical waste are not well handled, I mean, that's what results in all that, including HIV amongst others.
So the truth of the matter is, for states that are just beginning with medical waste management, what we did was we tried to educate the doctors and the nurses, and they said to us, "We like what we're hearing. Thank you for the education, but it's the administrators of the facilities that really need to be educated so they can support the healthcare waste management." So when the facility leaders, the administrators and doctors are on board, then they implement the necessary changes, because change is hard, as we both know. But they will implement the necessary changes for prevention. And once you begin to take it from the top down and educate the people that are doctors and nurses, it works from both ends.
Health is wealth, they say, and faith is disease. If we live in a filthy environment, we are taking a lot of risk. If we don't dispose of our waste in a proper manner, there are a lot of communicable diseases that we are going to be exposed to. Secondly, this waste will be sources of food for ruminants, for rodents, for flies, with their attendant complications. In those days, you remember, lice were common things, bed bugs were common things. Just because inside the same room you have the waste, and these are food for all this. So it is important for us to dispose of our waste in the proper way so as to reduce the risk of health implications.
1 ounce of prevention is worth a pound of cure. So if you can prevent people from getting hepatitis and HIV and other bloodborne pathogens, or cholera from infected needles, smallpox I've heard about from landfills, then you save a lot of money and a lot of lives. So the investment is small compared to the benefits.
Experts at the summit agree that the national policy on healthcare waste, if properly handled, will save the country a lot of money in the treatment of diseases that can be prevented.